welcome to our last cycle awareness series of womb talks for September. And it's going to be a huge one. We've had this whole month of topics all around raising awareness of your cycles and educating menstruators. And this one's a particularly big one because I guess it's a theme that keeps coming up throughout all of our womb talks. And it's all about understanding contraception. And really our aim for tonight is to educate you, just to be able to make better informed health decisions. So there is no bias here. It's all just about you getting the knowledge that you need to understand all about contraception, the effects, the impacts that it has on our body, so you can make better informed decisions. And we really would love, we've had a series of feedback and questions sort of throughout the month, particularly with Womb Talk. So if you have anything in particular around understanding contraception and the impacts on things like endo, adeno, PMS, PCOS, meno, please submit your questions and we'll do the best that we can to get to them by the end of the night. And so like I mentioned, this is our last womb talks for September, but what we'll be doing is running womb talks ongoing. It will be probably once a month from now on. I've just lost Man, so I'll grab her back in. But really, just so you understand, AMP, All Natural Pharmacy, we're really close to launching now, hopefully in early October. But we're all about debunking the myths and talking openly about periods, about our cycles. And our mission, honestly, is just to educate menstruators globally about their fifth vital sign so we can just all make better informed health decisions. It's a really important mission of ours, and we'll be still continuing to run these sessions ongoing. So please do stay tuned, follow us on Instagram, and go to our website, email us any questions. We're really open to kind of getting community feedback. And we'll also be looking for feedback on some future topics as well for womb talks. We've already had a lot of requests around like endo, adeno, and really sort of deep diving into each one of those conditions. So we will be running those in the future months as well. I will just try and grab Mans back in. For those of you who are just joining, Amanda just had to finish with her last patient. She's had a really big day. I will just grab her back in because somehow she's dropped out. And please, just any questions, pop them in the comments. We'll get to them as soon as we can. It's a really fitting time for us to be talking about contraception and sort of understanding contraception. And I guess when we're talking about contraception, it's about birth control. And it's a really fitting time. And I'm not sure if anyone's seen the news recently, actually, just around people trying to take their health into their own hands and kind of be able to be empowered and making decisions around their own health. I'm not sure if anyone who's watching tonight actually has seen, but there was an article released recently in The Guardian, I think it was in The Age as well, just around a TikTok video that has gone completely viral because somebody at home was trying to remove their own UDID based on the side effects that it was having on their body. So, oh, hi, Mans. How you going? I'm just talking about the article in The Guardian. But, yeah, it's just such a fitting time for us to be talking about contraception and also taking our health and our choices into our own hands. And, this kind of newsworthy video that's gone viral on TikTok of someone just saying how easy it is to remove a UDID is really just interesting and fitting and really poses kind of the conversation for tonight, right? Because there are people that, if you see it, I'm not sure if many of you sort of troll forums, but my first go-to when there's something sort of up with my body is to go online and Google. Of course, we all Dr. Google, but and then I end up in this deep dive of forums and you start to realize that people actually have kind of common side effects and common, occurrences as what you do to different kind of contraception and birth control. And we kind of start to normalize it. But I think it's just really important that we do have these conversations where we realize the impacts and potential side effects on our body and the conditions, that come, the T's and C's that come with contraception and birth control.
True.
Mans, are you done? Can we
No, I will be in just a couple of minutes. I've just got cups on and then I'll take those off.
Great. That's
and
so
then
fine.
And then we can start. But what I did think that you would find interesting is on the topic.
She's BYO'd something.
Can I get it open? Yes.
What is it?
So this is a diaphragm. So
Diaphragm.
this is basically a non-invasive, non-hormonal form of contraception, and this has been my contraception. So for a very long time, since I was 15, I had my first diaphragm fitted. Because interestingly enough, I couldn't go on the contraceptive pill. It made me really sick and nauseous, had lots of side effects, big mood changes. So when I had a teenage pregnancy, of course, learnt the hard way, was that I then went to see I went to see a nurse that specialised in natural fertility awareness method. So I learnt to track my cycle from the age of 15, which I think is really important because it teaches us and gets us to build an intimate relationship with our body, understanding the different hormonal changes throughout and noticing all the changes within your body from your cervical mucus, of course, because our body's always communicating with us. So really understanding the intimacy of how my body works, essentially. And so this here, basically, you put a spermicide on it. So the spermicide acts, it's like suicide for the sperm.
What's spermicide?
So spermicide is what you can buy from the pharmacy, and so it basically it's a barrier. So it kills the sperm, and it's similar to essentially what the pill does. It thickens our cervical mucus, making it like a spermicide, which basically kills the sperm or prevents them from swimming up the fallopian tubes and further up the vagina. And so you put, instead of a menstrual cup, it sits on the top here of the cervix.
Right.
And then that acts as a barrier.
All the time? What about when you are about to bleed or when you're bleeding? Do you take the diaphragm out? So you want to just use this at the times that you're wanting to have sex. So you insert it before you're having sex, and then it stays in for a minimum of 6 hours and no longer than 24 hours. So it's fine. I think it's fine when you've been in a relationship for a little while, because otherwise you're going to go, hang on, I'm just going to pull this out of my bag. Just give me a moment. I'm going to go pop my diaphragm in. Let me kill the mood for a sec.
All right, let me take these cups off.
Okay, take the cups off. Awesome. I'm actually really curious to know, and I know that there's a few like avid followers on AMP, so if you're happy to contribute, can anyone share what contraception they've been on or they are on currently? I from a very young age personally went on the pill, and I went through a bunch of different pills, and I've actually had endometriosis, or I do have endometriosis, but for so long it's been undiagnosed. And so it's really interesting because I had heavy bleeding, and I'd constantly go from one gynecologist to a doctor to a specialist, and I'd just be put on the pill, right, as an automatic kind of answer or a band-aid solution. So it's really interesting the more that I talk to people about that, because I didn't realize at the time I was going on the pill, but it was having side effects on my body, from nausea, fatigue, weight gain. And I try all different types of pills, and really all it would do is, to be honest, mask my symptoms and mask my periods and kind of give me a bit of a fake period, which we'll talk about. But I've been on the pill, I've been on the mirena, I've had the mirena as well, and needed to get that out straight away. I've been on the Nuva ring, and all of these contraceptives have actually given me a really high level of side effects. And so I think also we constantly kind of go onto these, different birth control alternatives, but we don't necessarily realize the impact and the side effects and what they're doing to our body. And so I think it's really important for us to kind of talk about that. Mans, are you back now? Good. Can I start? Yeah. Can I start heckling some questions at you? Because tonight we've got a really, really meaty one, and it's a really relevant topic. And I think the more that we talk about our cycles, the more that we talk about periods, it's important that we just talk about contraception, birth control, and options as well. I love that you've just brought out the diaphragm, because I've never considered using a diaphragm very seriously. So I think it's about kind of talking about what our alternatives are to contraception that might not necessarily be the pill or the UDID or. So I might get started, Mans, if I may, and obviously welcome you, founder of ANP and the Wizard. But can I just maybe start with a real basic kind of question, which is, why did contraception come about? And I guess we've spoken about this a little bit in the past couple of weeks, but can you elaborate on why did contraception come about?
So originally, it was designed, there was a guy, his name is, I've done some research because I found it quite fascinating, developed by an American biologist, and his name was Dr. Gregory Pincus. So it basically started with Mexican yam, and Mexican yam is a form of natural progesterone. And so essentially he was using that to support women that had had repeated miscarriages, to help boost their progesterone levels, and then also for menopausal women. And then, of course, that was in the 1950s is that, of course, then they started experimenting, and then he realized that he'd actually be able to use it for contraception. So essentially the pill has been designed for sexual liberation. It took the stress off us having to think about the times that we were ovulating, because if you think about it, not many people really know when they're ovulating unless you track your cycle. And so the pill, as we spoke about last week, essentially is designed to mimic a 28-day cycle. So this is where we got that myth from, that all cycles are 28 days. We know that cycle lengths vary. And essentially what that was doing, it's synthetic hormones. So it's a synthetic estrogen, and that is ethinyl estradiol. And then we have a synthetic progesterone, which is or progestin, which is basically most of them come from, I can never pronounce it, it's levonorgestrel.
That's a big one, isn't it?
That's a big word, right? And so these two so basically the estradiol stops the egg from being released, and then the progestin is essentially what thickens the endometrium and then the cervical mucus. So essentially, yep.
Oh no, you go. You go. I was just going to say, to wrap that one up though, because we went from why contraception started, which was in the 1950s in Mexico, was it?
No, it was in America.
In America.
In America. Yeah.
And so we've gone from there, and what you're talking about now around kind of the fake cycle and stuff, are you talking specifically about the pill?
Yeah, specifically about the pill. So this is kind of like the history of the pill, right?
Yeah. Cool.
So then yeah, you go.
No, you go.
So it was approved for release in the 1960s, and the uptake was swift. Within 2 years, it was used by 1.2 million American women. Wow. So interestingly enough, the pill comes in 32 different forms worldwide, and it's taken by 100 million women.
Worldwide. I mean, that's massive, isn't it?
Yeah, it's huge.
The thing is, man, like, you're touching on just the pill right now. And when we think about like forms of contraception / birth control, there are so many different use cases. It's not just the pill. There's like the mirena, the hormonal ring, the diaphragm, and you can kind of roll off others. But I think we've got to be really mindful that stat that you've just reeled off is actually just about the pill in itself.
So that's where it started in terms of, the liberation and then contraception as well. Because from there's then been many derivatives because they've been able to research more. Yeah.
Yeah, because we've spoken a little bit around, and in the last sort of past session, so we won't go too far, but just around how our whole bodies, our as females and menstruators, we are here to reproduce. But what we've done for so many years is kind of worked on like the whole thing of don't fall pregnant. This is what you can do to not fall pregnant. And so I think it's really important to actually touch on all of the different types of contraception that have evolved now over the years, since obviously the start of the pill. So yes. Are you able to kind of like talk to us around a few of, and it doesn't have to be a timeline of the evolution, but if you've got it, great, but just more so, can you talk to us more around like the different types of birth control that have evolved over the years, and I guess like their use cases, like why might someone choose to be on a pill versus have the mirena, for example, you know.
Okay.
So if you
All
can
right,
talk us through the different alternatives, that'd be great.
So the non-hormonal is a copper IUD. Now you may have seen that. That's composed of a frameless device that is anchored into the myometrium. So the myometrium is our muscle layer of our uterus. So it anchors in. It's like a T shape. And so it's kind of like this. Basically, it's got a copper filament around it. And the T-shaped core copper is placed on a vertical stem and horizontal arms. It connects to the microfilament thread that protrudes through the cervical canal to the upper fundus, which is the top of the uterus, right? The upper vagina.
Right.
So the copper IUD essentially prevents fertilization through releasing a cytotoxic inflammation reaction that is spermicidal. So basically it means if anything was to hit the endometrium, and the endometrium is the lining that we shed, which is what our blood is each month. And so it also, to the copper concentration that it releases, also then changes the cervical mucus, because the cervical mucus is essentially used to transport the sperm up to the fallopian tube to fertilize the egg, right? So we want to change the content of our cervical mucus. And so essentially, basically alters the viability of the endometrium, making it spermicidal, suicidal to sperm. What's great about the copper IUD is that it's non-hormonal. So as soon as you immediately remove it, your cycle is returned back to normal. The problem is that what they've found is with the copper IUD, particularly with women with endometriosis and adenomyosis, is that periods become longer and heavier over prolonged use. Menstrual blood, and this is a statistic from a research paper, it increases by 50% in heaviness. So anyone that's been on a copper IUD reports definitely heavy menstrual bleeding. So
while they're on it or once they're off it? Sorry,
no,
Matt.
while they're
off it, or what? Okay, while they're on it.
While they're on it, it actually increases your menstrual bleed to be heavier, and it also increases dysmenorrhea, and dysmenorrhea means painful periods. So the clinical significance of this is that it leads to anemia, so a depletion of your iron stores, and this can be then seen if you do your blood work, you'll see a reduced amount in your ferritin levels and your iron stores. So the main reason why people decide to get the copper IUD removed is because of heavy bleeding and then also dysmenorrhea, painful periods.
Yeah, which is interesting because you would go on the IUD to try and probably reduce your bleeds, but actually it's making it worse. Yeah.
And so this is where it's really important if you're deciding to go on the copper IUD and use that because you're looking for a non-hormonal, it's just the copper concentrations that are released into the endometrium, is that's where it's really important that your doctor asks you about the history of your periods. Do you suffer from heavy periods? Is there a history of endometriosis? Because most of the time you should not go on it if you've got heavy bleeding, because it'll increase your bleeding. And then also too, if you've got endometriosis, adenomyosis and fibroids that lead to heavy menstrual bleeding.
Wow. I mean, that's so interesting because I know a few people that are already on this in our audience tonight who have had side effects from the UID, thinking that was the best option for them. You know, another fellow kind of endo warrior and probably had these side effects that you're talking about plus more, but we just don't realize, I guess, and we kind of just put up with it because you think that you're doing something good for your body, that's what the solution must be. And so what other kind of common use cases are there for and what other kind of contraception? So we've spoken obviously about the UID, and you touched on the pill before. Can we talk a little bit around the pill and some of those side effects and I guess common use cases?
I mean, the thing is, it was fascinating to researching, and because it was so basically the side effects in the 1970s was that smoking and the pill caused an increase in blood clots. So we know that particular types of contraception, it was Yasmin. So Yasmin was known specifically. There was a legal case around that causes blood clots, which can lead to a stroke. So, I mean, it's huge when you think about it. And it's also too, the World Health Organization has listed the contraceptive pill as a carcinogenic, which, yeah. Right. So, I mean, it is toxic. Essentially, it is shutting down our biological feedback system of our hypothalamus, pituitary, ovarian axis. So it's shutting down our ovulatory cycle, right, to mimic with synthetic hormones a cycle, an induced cycle, which then is a withdrawal bleed. So another study showed 125% increase in breast cancer for women who used hormonal contraception for more than 4 years before having a full-term pregnancy. And then a 1990 study confirmed this. So it's interesting because of the synthetic estrogen, and potentially that's why it's really important to look at your family history if you do have breast cancers, to speak to your doctors and find out which contraceptive pill is actually going to be right for you. Yes. Maybe you just go a total progesterone only pill, which is the Yasmin, but then that has side effects as well. Scientists have also found that women's brains of people on the pill are fundamentally different compared to women who are not on the pill. It changes your sex hormones, of course, and then influences your cognitive function to be able to deal with stress. Increased risk of anxiety and depression, which we know, and then women aged between 15 to 19, there's an increased suicidal risk.
Yeah, it's so interesting, man, because like in my own friendship circle, we've noticed once we've come off the pill, we're like, oh my gosh, this is normal Teresa. Oh, this is what blah blah's like. You know, you have a moment where you're like, hold on, was I a bit mad on the pill? You know, and you're right, it does actually change your makeup, your mood, and really does shift things in your body. But I think you only become aware once you're off it. And so many females talk about that, menstruators talk about that.
True. It's like you come back to yourself, but yeah. I think you have to go through it and just go, actually, why am I? Or that's the thing, like women don't question it because the taboo or the stigma's always been, no, you're crazy. Your hormones make you crazy. Yes. So you go on the pill and then you'd be like, well, why is that actually making me crazy? No, it's just my hormones, right? But it's the synthetic hormones that are creating that endocrine change and endocrine disruption. And this is what I found really interesting. Okay, so it was kind of like, so progestin is basically, it's the progesterone, it's the fake progestin, and basically all the derivatives that come out of this levonorgestrel, which is found in all the contraceptive pills, basically it's very similar, the chemical structure, to testosterone. And so what happens is that the progestin still produces androgens, and then these androgens will then bind to androgen receptors. So you have androgen receptors on your hair, you have androgen receptors, sweat glands, and then there's also androgen receptors on your ovaries. And so this got me thinking, because women that come off the contraceptive pill that had no history of polycystic ovarian syndrome then have all these cysts on their ovaries post coming off the pill. And I'm like, the reason why that is, is because the progestin is producing androgens. The androgens then bind to receptors on the ovaries that contain testosterone. So it actually increases the amount of cysts that you have on your ovaries, which is why then you come off the pill and you're like, I've got polycystic ovarian syndrome.
Totally. So common.
And so I didn't even know that. I was like, this is insane. So this is probably why there's an epidemic as well of polycystic ovarian syndrome, because it's actually producing androgens. So it's creating a hormone dysregulation in your body. And then also too, sometimes too, you may not actually have polycystic ovarian syndrome. It just could be that you have polycystic ovaries, but more an androgynous type without the symptoms of polycystic ovarian syndrome, which is elevated testosterone levels, elevated DHEA levels, because then coming off. Yeah.
Oh, you go. No, go.
No, you go.
Finish.
Because also too, coming off the pill, you can have multiple follicles. You can have 26 follicles either side, which would be diagnosed as polycystic ovarian syndrome, and then not have a period for an entire year. And you go and do blood tests, and your blood tests show that your hormones are at baseline, so they're showing no fluctuation in LH, estrogen. And your testosterone and DHEA levels are at baseline. So what that means is that your body's actually then gone into hypothalamic amenorrhea, which means no periods. So you can have all these cysts on your ovaries, but not actually have polycystic ovarian syndrome. Instead, you've got hypothalamic amenorrhea, which just means no period.
Right. And so, okay, so you've spoken a little bit now around PCOS and kind of, you know, the potential after effects of coming off the pill and that kind of you've closed the loop basically. And I laughed at the comment before, which was like, my wig has been blown off. But it is, you've kind of closed the loop there. But so can we talk about the impacts? And again, you spoke a little bit more before around the IUD and endo. But so what are the effects of contraception, birth control on things like endo, adeno, PMS, meno? Can you talk a little bit to that?
Okay, so and interestingly enough, so the contraceptive pill, basically they've said from the researchers that they don't know, there's lack of evidence to show that the contraceptive pill actually reduces the amount of endometriosis that grows. But when I come to, I've got some really good stats for the mirena. So we know, so essentially the contraceptive pill for women, I think that, or menstruators that are suffering from endometriosis will try the contraceptive pill and do find that it actually reduces the amount of pain that they're having. This is also too because the progestin, they did find that the progestin, if it goes into the peritoneal fluid for endo sufferers, is that it can reduce the pain. Our reproductive organs are bathed in peritoneal fluid essentially, and so normally they have high cytokine markers, which is what causes the pain. So the progestin can potentially reduce that pain if it goes into the peritoneal fluid. So women do report, in the sense is that because you're shutting down your hypothalamus pituitary ovarian axis with the contraceptive pill, is that you're shutting down the E2, which is the estradiol, which is a growth factor for endometriosis. So when you're shutting down that estrogen pathway from each month you're growing a dominant follicle, is that essentially you're stopping the endometriosis tissue from growing. Essentially, but it can still grow behind the scenes. So I think that's where it would be great if we could do a study to put women on the contraceptive pill, have a surgery, they go on the contraceptive pill, then go back to see whether there's actually been growth. Because I think for endo sufferers is that sometimes it's like, if you're just in chronic of a normal life, and so if you need to be on contraception, it's really important to explore that option.
And so when you're talking around kind of like, I mean, we're talking about some of the impacts, I guess, of contraception on our bodies with conditions, but can we just talk a little bit around, so for people that aren't necessarily diagnosed with endo, PCOS, or all the rest, can we just talk around some of the common kind of side effects of contraception broadly? And we did talk a little bit about that before, just with kind of the pill and, you know, you thinking that you're a little bit, oh, it's my hormones, but you're actually going a bit mad. Like, can we talk about that? Because I think that we often don't share it. And the only reason that I've come off, you know, particular different pills or, you know, removed my own NuvaRing is because I've felt actually quite, you know, if I can say it, unhinged, you know, like not quite, you know, mentally there. And so I think there are some real common side effects to contraception, which we can probably talk about, because I think that most people here who have tried any kind of contraception or are on it might have those side effects. And it took me, again, like I was sort of saying before, to deep dive into the forums on Google to go, oh my gosh, this is really common, you know? But yeah, so can we talk about some of the common side effects aside from, you know, the endo, adeno, and so on? But what are common side effects to contraception that we just should be aware of?
Is weight gain, is mood changes, is energy levels. You can have acne. You can also, sometimes too, you can have a lighter bleed, which is a withdrawal bleed. It also destroys your gut microbiome. It also changes the pH of your internal ecosystem of your vaginally. So a lot of women that are on the contraceptive pill over a period of time find that they have more UTIs and also a higher amount of thrush and candida. That's because you're disrupting your microbiome. It also depletes your essential minerals such as your zinc. It can also zinc, I think, what else is there? Iron, and also I can't remember.
That's all right. I mean, that's a huge list, like, and it's massive. And probably, you know, I would say that most of us, and I'll speak again personally from my experience, but most of us kind of go through our journeys on contraception and just go, oh yeah, that's normal, like whatever. You don't even kind of consciously realize that that actually could be a side effect.
Oh, low libido too. Low libido is a huge one.
Yeah, that was huge. Yeah.
Not interested.
Yeah, which is interesting because you're going on it to have a contraception and then you're like...
Well, for sexual liberation, right? But am I horny?
Totally.
Fuck no.
Yeah, no. Yeah, totally. Yeah. And so there's some of the side effects whilst you're, you know, on some form of contraception. What about long-term side effects? And again, you spoke a little bit and reeled off some stats around like the pill and kind of like breast cancer and the link to that, which I think we're all a little bit privy to. Like they do talk about that and warn you when they put you on a pill. But are there any kind of other long-term side effects that we should know about?
Well, I think if you're on the contraceptive pill for 15 years, you have shut down your biological feedback system of your hypothalamus, pituitary, ovarian axis, which is your ovulatory cycle. So, of course, that's going to impact your fertility. And that's what we see a lot of in clinic is women being on the pill for a very long period of time. And then it's trying to establish and restore your period again. So sometimes that can be 6 months. It could be a year. It could be 2 years. Sometimes then you need to go into fertility treatment to actually induce an ovulatory cycle, to have ovulation and then to have a period. So I think, you know, long term, if you're doing it, it's like speaking to your healthcare provider and then finding out which contraception is going to be the best for you, and then cycle on and off. Like if you're not in a relationship with someone, then come off the contraceptive pill, give your body some time to find its natural rhythm again, and to have then a natural bleed.
Yeah, which is great because it kind of segues into one of my pressing questions, and I hope it doesn't put you in the spot, but like what are alternatives then to contraception? Because I guess it's so common for us to be just like still now thrown on the pill. And so like it's kind of a double, it's a two sort of question, but like one is, I guess, double-edged sword. Thanks. That's the word that I was looking for. But, you know, like how do we move away from that autopilot kind of solution of go on the pill? And then what are some alternative contraceptions? Like, you know, I learned about the diaphragm tonight.
Yeah. So
can you kind of talk to us a little bit around some alternatives?
Withdrawal method has a 96% success rate. So how good's that? Yeah.
Kids, don't tell your parents that.
I think I've got to double check that. I was looking at the stats. I think I just went, what? Yeah. So
96%.
because it's the amount of ejaculate and pre-cum as well. So it doesn't always necessarily it won't always necessarily fertilize an egg. So, I mean, withdrawal method is highly effective. Of course, then you've got your natural fertility awareness method, which is learning to track your cycle, do your BBT charting, your temperature. And I think that's a really effective way as well, because then you get to see the rises, you get to see the time that you're ovulating. So, I mean, and having sex sort of like either side of your fertile window is that sperm can actually survive for around 5 days. These days, it's a lot harder because you're dealing with the different quality of sperms also drop, the health of sperm. So there's so many different factors that can affect that. So I think, you know, I've been tracking my cycle for 25 years, or since I was 15. I'm nearly 44. So 30 years.
Don't look a day over 30, man.
Yeah, thanks. So
yeah.
No, Steph, it's not. It was from a contraception website. So.
No, but yeah, I guess like, and I have to just put my like legal hat on for a sec. Like, we're not giving, you know, hardcore advice. We're just having a conversation here. So when you say that that it's 96% successful, don't be like, oh, I watched this Womb Talks and they said I could withdraw and now I'm pregnant. Shit, you know. So we do need to just disclaimer that. And you know, it is just up to understanding, you know, what is right for your body and what's the right method for you for contraception. And so I guess I just need to caveat that one. Disclaimer, T's and C's apply.
Apps don't work either, you know. The apps will say you're fertile and you're actually fertile at a different time. So
yeah, totally.
Really, super important to be really in touch with your body and understand your signs and your symptoms, your cervical mucus, to really notice that change. And also to the other natural forms are a vasectomy, of course, for men, and then also for women having your tubes tied, which I think, you know, that's something that you may look down the track once you've, you know, decided that you've had children. But that's also too, quite from the experiences we've had from women in clinic, is it's sort of like ghost pain, because they tie the end of your fallopian tube. So it's almost like you feel like you're ovulating every month still. It's almost like you can feel it. Right. So, and it can be, in terms of like afterwards, it can be quite painful. So
yeah.
Do you want to go through like the NuvaRing and the Depo-Vera?
Yeah, we didn't actually go into that. If you have some stats to reel off that aren't from Wikipedia, thanks, Steph. Then yeah, no, if you've got some more info to deep dive into those, that'd be great. Like, I've had personal experiences, like I've mentioned, with the NuvaRing, and honestly, like, my personal experience was just horrific, and I didn't realize that it was the NuvaRing that was doing it.
How did you find that?
So I went on the NuvaRing, like, personal overshare here, but I went on the NuvaRing because I personally felt pregnant, and then I went, and as a form of contraception, they were like, let's make sure that you don't fall pregnant again. Pop onto the NuvaRing. It's sort of like the least, you know, it's the one that's going to have the least side effects, and it doesn't release as much hormones, and I'm not probably doing it justice, but I was given medical advice basically to go on the NuvaRing. And honestly, I think I was on it for about a week or two, and just felt so overly emotional, was curled up on the couch, feeling absolutely horrendous, so up and down, low energy levels. And it took me to go Google and go onto a forum to realize that all of these other women and menstruators globally had the same kind of side effects. And I was just like, do you know what? This is enough. I'm taking it out. I mean, I didn't film it and put it on TikTok, and the video didn't go viral, but
because that one's easily removable as well, isn't it?
It's really easily removable.
Do you keep it in for 3 weeks as well, then take it out?
Yeah. So you pop it in for 3 weeks and then you take it out. And it also feels like, you know, I don't know, like when you're a teenager and you first put a tampon up and you're a bit like, oh, this is a bit uncomfortable. I can feel it. I'm not supposed to feel it. It was like that the whole time. So maybe I didn't also insert it properly, but it really felt very uncomfortable.
What was that like having sex?
Yeah, I didn't want to have sex, man. I'm pretty sure I didn't even have sex in that 3 weeks that I had it in me, because I was like, please don't come near me. I've got zero desire, zero libido, you know?
Oh my God. Because I know, it's like when it goes in, I was like, does that actually like get out of the way for when you're having sex?
No. I'm pretty sure there's stories also of like it can come out obviously when you're having sex as well. We've got a question. I mean, we'll answer this anyway, Marquez, but what is a NuvaRing? So can you talk about what a NuvaRing is, and then kind of some use cases and any data that you found on that?
So it's a soft, flexible, transparent ring that measures about 54 millimeters and 4 millimeters thickness. So it's easily inserted by yourself, as you know, thanks for that shared experience there, into the vagina. So basically, like you're saying, you use it for 3 weeks and then you remove it for a week. And then, of course, you have a withdrawal bleed. So it releases a hormone, the ethinyl estradiol. And so it also has a little bit of etongesterol, basically. And so what it does is it steadily releases over time that the estradiol, the ethanol estradiol, and that basically goes then into the cervix, and into the endometrium. But what it said was that it basically absorbed into the vaginal epithelium as well, which makes it because our vagina is super highly absorbable, the skin on the outside. But like lots of women reported leukorrhea, which is increased cervical mucus, candida, vaginitis, breast tenderness, headaches. And then it was also said that the vaginal route of hormone administration is basically with higher doses of adverse reactions. So uncomfortability, pain in your vagina. So I think sometimes you got to try it, don't you, to know?
Well, you do. And that's what I was just going to say, right? Like it's different bodies and it's case by case, you know, and obviously the NuvaRing, for example, didn't suit me, but it might suit somebody else that's watching this. And I guess you do need to trial, but with that trial and error, it's kind of being aware of the potential side effects and impact that all different kind of contraception can have on your body. I think it's really important because each individual is different. And so it might not suit me and my makeup and the fact that I've got endo, you know, but it might suit somebody else and their body and their kind of makeup.
And I think that's the thing, you know, it's good that there's options available. And like you said, it's just trying different ones that work for you.
Yeah. And so, Mans, like, what do you think? Because we're now we're almost at 45. So I will start to wrap it up. But what do you think?
Let me talk about the mirena.
You go.
Okay. So because we have quite a few questions that came in about adeno, endo, and the mirena. So basically the mirena its basic use was for heavy menstrual bleeding, and 30% of women present with heavy menstrual bleeding. It's also used for adenomyosis, endometriosis, menorrhagia, which is heavy bleeding, and lyomas. It's an alternative for an endometrial ablation, and trans cervical resection. It's also used for women in perimenopause due to anovulatory cycles such as hot flushes, mood changes, sleep, and it also helps to assist with dysmenorrhea, which is painful periods in endo. So it's a T body shape sleeve, and it's covered with a drug release controlling membrane of a medical grade polydimethoxane, which is basically, I researched that, and that's actually a dirty dozen. So it's a silicon, it's highly chemical, it can cause tumors in your vagina. I was like, it's used in medical grade things, so, like that as the pill. So it releases the progestin over extended time of up to 5 years. So it also contains a barium sulfate. It can lead to things such as depression and reduced natural killer cell activity. It's also an endocrine disruptor. These are some of the side effects. It's known to cause some uterine tumors and also harm reproductive and immune systems. It takes 7 days to provide effective contraception. So no sex within that time. And women still, you produce a normal amount of estradiol from the time the insertion goes in. So this doesn't lead to osteoporosis. Okay. So the problem, I'll just quickly add, so with the mirena, for women that have been through trauma, sexual abuse, it's really important that you have your mirena inserted when you're under an anesthetic, as opposed to having it inserted internally in the doctor's office, because what it does, because it's been inserted into the wall of the cervix, is it causes pain. And then because the uterus is a muscle and the vagina is that, then you clamp, and so you go into that flight, fight or freeze, and it makes it extremely difficult to be able to insert it. So if there's trauma there, please go under to have it, or you need a cervical dilation to have it inserted.
That's a really good point that you mentioned.
I want to just state here that it was saying that for endo, insufficient evidence for other benefits for fertility, but what it does is it does downregulate progesterone and estrogen receptors in the endometrium to inhibit endometrial production, which basically means of that growth factor. So it can, you know, stop the growth of endo, but studies are limited. But for adenomyosis, it's the go-to. And this is what is amazing, because studies are limited, but it significantly reduces pain and abnormal bleeding alongside reducing the adenomyotic lesions. And what's amazing is that our tincture, with the research, actually reduces, the adeno tincture actually reduces adenomyotic lesions. So it's been found in one of the research studies, which I think is huge. So it does the same thing as the mirena, but it actually, you know,
and it's all natural and it's plant-based. Let me just reel off the benefits.
So essentially it'll stop your menstruation, so it'll cease your bleeding, and that also helps improve your iron stores if you have low iron and ferritin stores. What are the things that women do find? I never forget a client. So basically, it wasn't inserted properly. Every time she was having sex, her partner's penis kept, the tip of the penis kept hitting the mirena, and then it indented his penis and then started to take the top of the penis off, like the shaft.
You didn't provide us with a warning then, man. You just went straight in.
I'm used to it, right?
I mean, how painful for both parties, though. Like, what an awful experience for her and then her partner. Like, it's just,
So she got it out. So that was our adenomyosis tincture. It also,
we're talking about the mirena. Sorry, just Sandra's just asked.
And
the product.
Also too, women will have expulsion, so you'll feel like it wants to come out, or you'll have an expulsion of the mirena. It also can cause intracranial hypertension. It also can cause ovarian cysts. So I know that a lot of women in clinic that have had the mirena inserted have then gone for a pelvic ultrasound and they've got ovarian cysts. So that's a good link there to note. One, you know, if you are in your postpartum period, you can have it inserted up to 8 weeks after 8 weeks. You can also breastfeed whilst on it. So what was I going to say? I think there was another study for adenomyosis, but I think, you know, it's like you can be on it for a period of time, and then they were saying for adeno to change it every 3 years. They found that women had better results changing it every 3 years.
Yeah. And so, like, Mans, I have to kind of just close the loop on all of this, because I mean there's so much information to be taken in on all different contraceptions. You look like you want to reel off another stat, or you want to talk about something else. No, are you good? You got it out.
Good.
And so I guess, like, for me it's trying to understand, and probably for most people, like, how do we find out more about our contraceptive choices outside of our go-to is to get medical advice, and sometimes, you know, it's not necessarily accurate for our body, or we kind of just trial things. Like, what alternatives do we have, and how do we find out more info about different types of contraception, and the fact that, I guess, how do we realize that we have a choice in all of this as well for our bodies and what suits, you know?
That's where it's good to go to a
question. Sorry.
I mean, it's good to go to a family planning, to speak to a sexologist as well. Family planning is always really good, because they're not just going to go, okay, just go on the contraceptive pill. They'll actually sit there and discuss with you your options. So I think that's always really, that's a super important one to note. That's what I had done when I was younger as well, because then you're aware of all the different types, and you might say, okay, I'm going to try this. I think for most, it's like, you know, when you're having, if you're getting acne, when you're in your teenage years, it's really to kind of look at the underlying hormonal imbalance going on there, to look at your gut health, rather than necessarily just going, I'm going to go on the contraceptive pill. And then I think to really speak to, if not speak to your doctor, or do some research. There's so much information available on the net.
I think something that I've also taken away probably from this session is that, you know, everybody's makeup and bodies are different and may react different to different types of contraception. So it's probably important to get some tests and realize, you know, I only realized that I had endo, for example, after I went through this journey with all these different contraceptions, and then, you know, led to PCOS and blah, blah, and so on, like we were talking about before. So I think a really big part is probably actually getting to know your body, understanding your cycles, understanding all the side effects, and then actually going and getting the right tests before you kind of make that choice or make that decision, whatever that is. You know, I think that's really important to understand what's going on in your own body. And yes, absolutely, we have like shared experiences and shared side effects, and there's common side effects to all these things, but it's about really understanding what's right for you and making those choices, you know?
Yeah, absolutely.
We have a question here. The mirena really helps your adeno, but the issue of recurring painful ovarian cysts. So does the mirena,
that's one of the side effects, that the mirena does cause ovarian cysts. So I think it's that's, you know, it's like if you're having to go in and to have surgery for those ovarian cysts, and do they burst a lot? Are they causing you to go into hospital? So I think that's something that you would then speak to your specialist about. So whether you've got an endo specialist to see, then potentially maybe that's not the right contraception, but then if you did a copper IUD, that would increase the heaviness of your period. So it's a bit of a catch-22. So that's also too where I'd say, look, try the adenomyosis drops, because it does help too with cramping a bulky uterus. I've been on the drops for over a year, and I've had a pelvic ultrasound, and my size of my bulky uterus has reduced, which is amazing. So it's really nice to be able to see those physical results and to see those positive changes. Absolutely. Anyone else got any other questions before we finish up? I hope that helped you there.
Yeah, so helpful. Before Sandra, just to clarify, I did ask a question around what tinctures we were talking about. We were talking about the adenomyosis tincture, but we've got 5 in the all natural pharmacy range. And if you go onto our website, you'll be able to see them. And we'll have a new website in like 2 weeks.
Yay.
And you'll be able to shop off there and be able to try our subscription or buy a one-off tincture. But our tinctures are all plant-based, made of natural ingredients, ethically sourced. And definitely I've also been on the endo tincture for, I think, almost a year now since I've met you, Mans. And it's made a huge impact on my cycles. So, yeah, if there's no other questions, we might wrap up. If you have missed any of these womb talks at all, very exciting. We've set up a YouTube channel now, an all natural pharmacy YouTube channel, and we've turned these into a podcast. So the podcast is available on like Apple, Google, Spotify. So you can go back and listen to any womb talks that you may have missed, even previously to the September one. We will be running more of these ongoing, probably once a month, and we're open to any kind of suggestions on topics. We've got quite a few in the bank, so please do give us your suggestions. We're always open to feedback. I do have to do one more little quick disclaimer before we end. And I started the conversation, I think I called the IUD the UDID because of my tech background, and I'm really sorry, guys. So I just need to clarify that one. It's the IUD, not the UDID. I'm well aware. But good old Maddie picked me up on that, so thank you. It's just like but please do follow us for the launch. We will be launching in a couple of weeks, and thank you so much for all your support already. We really appreciate it. Thanks, Mans. You put in a hard slog. It's been a really long day, and you're taking off cups, you're taking out acupuncture, and you're on, you know. So thank you for being awesome.
Thanks, honey. Thanks everyone for tonight. We'll see you soon.
Thanks so much for joining. Have a great one.
Thanks.
See you soon.
Bye.
Bye.
Bye.